I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 42. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're talking about today is the opioid issue that we have, the opioid crisis, and things that you can do to help avoid getting to that level. Because, again, people need medication, and I understand that, and I understand cancer. Opioids work very well because the pain is so bad. Passing kidney stones, it's very bad. But a lot of times people say, well, I just want the opioids because I'm in a lot of pain. I've been in pain. I broke my back twice. I broke my arm several times. I totally get pain. If I have a blazing headache, I have no problem taking some acetaminophen and then going to my doctors and saying, find out why I have a headache. Well, I know that I can't do certain Thai foods because they have fish sauce in them. And even though I tell them time and time again, please, no fish sauce, a lot of times it's mixed in the sauce already, and the waiter goes, I don't care with fish sauce. And they give it to you, and then I get a blazing headache from it. So you got to start thinking about what's causing your pain. It took me a while to realize that if I ate Thai food and it had fish sauce in it, bam, I got a headache, even though I told them I'm a vegan, I don't eat animal products. So you got to start thinking, what is it? Artificial sweeteners. Number one side effect of aspartame is headaches. And I can't tell you how many people have come to me over the years, been in practice almost 34 years, and they come in and they say, Dr. Joe, I have blazing headaches, and we do chiropractic manipulations on them, we do adjustments, they do great. But then they say, Doc, I don't know what it was. All of a sudden, bam, this headache came back and hit me again. So what I tell them, I want you to do this too, is go to my website, drjoe.com, and under patient forms, we have something called the Diet Diary. It's free. Just print it up. It's just a form you're printing off my website. And I want you to start writing down everything you eat. When I say everything, everything. Breakfast, lunches, dinner, snacks, if you have a piece of gum, if you have a candy, I want everything. Because, for example, a lot of gum now is sweetened with artificial sweeteners. And if you're taking the gum, you may be getting an artificial sweetener, which is then triggering a headache. And you thought, well, gosh, what did I have for breakfast? Well, I had, Dr. Joe's Super Greens and Dr. Joe's Essential Source, which I have every day for breakfast. And then I had a couple of nuts, and then I had a salad, like Dr. Joe says. And, for dinner, I had some stir-fried veggies, and I'm avoiding breads and cookies and cakes and donuts and pastas, and I don't do alcohol. I'm doing everything Dr. Joe says, and I can't figure out why these headaches are coming in here. And then we look, and they say, oh, my gosh, every day I have gum. Something as simple as that. So maybe perfume, maybe hairspray, maybe deodorant. Anything that's scented can cause headaches. New car smell can cause headaches or pain. So when we're dealing with pain issues, we have to kind of do a little investigative work. And that's why I want you to go to my website, and you do this. This has nothing to do with me. Start writing down everything you eat. And then in the margin, notice, okay, I had a headache at 2 o'clock, or my back flared up, or gosh, I was so tired after lunch, I was exhausted. And then you start to look for a pattern. If you can't figure it out, come see us and we'll figure out the pattern for you in many cases. But simple test you can do. Tomorrow for lunch, I want you to have a big salad. Okay, and you can use apple cider vinegar and extra virgin olive oil as your salad dressing, and maybe some air-dried sea salt and some oregano, which is antibiotic and antiviral and antifungal. And try having a big salad for lunch. Maybe add some chickpeas to it if you want to get full, or some beans. And notice how you feel the rest of the day. The next day, I want you to have 2 or 3 slices of pizza with cheese on it, maybe some pepperoni as well, maybe a big soda. See how you feel in a few hours. You're going to be exhausted. You have to be. No one is immune to this. You're not Superman. So you're going to say, wow, when I eat the pizza and the soda or the cheesecake or whatever it is, I'm tired. Saturated fats from animal products can clump your red blood cells together. Red blood cells get clumped together. They can't carry oxygen. You get tired. Have some steak. Number one consumer of energy we have as humans is romance. Number 2 consumer of energy, animal products. So maybe you have a steak at lunch, you're tired. So this is the thing. This is one of the reasons that I personally started changing my diet. I want to live longer. I want to stay young. Had a lot of health problems as a child. But I want to have more energy. And I thought, let me try these different things. I experimented for years, months, I guess, trying different foods. And it was really clear to me. So I had to make a decision. What's more important to me? Meatball sandwich with provolone cheese, which, by the way, is one of my favorite foods in the world, Or do I want to have energy and give up half my day, or do I want to have energy the whole day? And to me, it wasn't worth it. Same thing with alcohol. I just didn't like drinking. I never liked. Even in high school, I remember sitting at football parties. I had my beer and standing around, and nobody's looking. I throw it away. Give me another one, man. Trying to be cool, And little did I know that it doesn't matter. No one really cares what you do. So why should you worry? So start writing down what you're eating and notice how you feel, and you'll be amazed. And then I would recommend adding Dr. Joe's Super Greens and Dr. Joe's Essential Source every day. Have it in the morning. I do it first thing in the morning because I can't remember to take it any other time because I get busy. And you'll say, wow, I feel so much better. I'm sleeping better. My energy's better. I'm sleeping better. And then what'll happen is you'll cheat. Everyone does. And you'll slip and go have that meatball sandwich, or you'll have that pizza with diet soda. And you're going to go, wow, Dr. Joe was right. And if you're a pain patient, which is what we're talking about today, start changing your diet. Alkalize your system. Here's a little test you can do. Get some pH paper. It's called pH paper. You can get it at a drugstore. Most drugstores carry it. If not, you can get it online. And it's little strips of paper. I don't know, maybe as big as your index finger. And tomorrow morning when you wake up, pee a little bit, first thing in the morning, to clear out your urethra, and then wave it through the paper, wave it through your urine stream, and there's going to be a color that comes up. There's going to be a color code that comes with the packet, and you want to be about 6.5 to 7.0. Different colors match to different numbers. 6.5 to 7.0. The closer you are to 7.0, the chances are you'll have more energy and you'll feel better. The closer you are to 6.5 or lower, chances are you're going to feel rotten. Try it. If I'm wrong, I'm wrong. So what? You spent a couple of dollars on pH paper. But if I'm right, which I am, then you're going to say, okay, this starts to make sense now. Dr. Joe was right. The chemical makeup of my body impacts my pain level, impacts my sleep level, impacts my energy level, impacts my health. Really does work. And this is how I deal with patients, or my team of doctors deal with patients when they're in our offices if they're pain patients. So we want to try to keep you off the opioids if we can. If you are on the opioids, how can we reduce the impact and hopefully reduce the amount? We can't tell you to come off your drugs. Patients come in our offices every day and say, Dr. Joe, I want you to get me off my blood pressure medication. I want to get off my cholesterol medication, off my diabetes medication. And I say, listen, we're going to do everything we can to get you healthy, so hopefully you don't need them. That's my goal. I can't take you off them, but I can get you healthy enough so that you don't need them. That's our plan. Back to what I was talking about. Got off on a tangent there. 60% of marijuana-only users were younger than 30. 39% of prescription drug users were over 50. So marijuana, younger generation. Prescription drugs, older generation. Sad, but it's true. Even drugs such as over-the-counter cold medications can make you sleepy and potentially dangerous behind the wheel. This is a CDC report estimated that 33% of all fatal crashes involve a drowsy driver. 33%. Now, if you're like me, you've probably fallen asleep behind a wheel. I mean, not, got into dream state, but your head starts bobbing a little bit. That's a dangerous place to be. You need to pull over. You need to stop driving. Loud in the radio doesn't work. Turning on the air conditioner doesn't work. Get up and move. Now, here's a little trick you might want to try if you're really tired. Now, you can do this every day of your life if you want. The right part of your brain controls the left side of your body. Left side of the brain controls the right side of your body. Okay, so the brain is integrated, not segregated. So if you're driving, you're using usually one arm. So you're using one side of your brain. You're using your right leg. You're using one side of your brain. The left side of the brain controlling the right side of the body. And so if you're really tired, get out of the car, and I want you to march in place. And the way you march is like this. Your right elbow goes to your left knee, and your left elbow goes to your right knee. It's called a cross crawl. Oop, hit my counter there. It's a cross crawl. And so what you're doing is you're integrating the brain. You're using the right side and the left side at the same time. And when you do that, just doing that for a few seconds just now, I felt a little burst of energy. Now, this cross crawl, I talk about it in my most recent book, Prescription for Extreme Health. And we talk about the cross crawl, how it affects the brain. And if you do this every day, I give you 1,000 different things you can do every day. Do some of them. But the cross crawl is easy because all of us, or if we can, we're walking somewhere. So get out of bed, walk to the bathroom. Right arm, left leg, left arm, right leg. Right arm, left leg, left arm, right leg. Now, whoever you live with is going to think that you're crazy. But that's okay because you're rebooting your brain. And a lot of people have reported to me, Dr. Joe, when I do this, and I do Super Greens and Essential Source, and I do the adrenal support, and I do nitric oxide, any or all, and I do the cross crawl, I don't need my coffee anymore. I don't need my cigarettes anymore because it's a stimulant. And what I'm doing is I'm naturally stimulating your body as opposed to suppressing your body and then trying to chemically stimulate it. So the cross crawl is really something neat that you can do to help give you energy. And many times if you're on pain meds, how many people have taken pain meds in their lives? I have. It's exhausting. Now, the pain meds can usually override something like a cross crawl, but it's just something else you can add. Water. If you're a chronic pain patient, folks, you got to start doing water, absolutely positively, because when your body starts to dehydrate, it gets tired. Another trick I tell people, wake up, have a big glass of water. Add some apple cider vinegar to it. Raw organic apple cider vinegar also helps give you a burst of energy. So if you took a tablespoon or two of raw organic apple cider vinegar with a big glass of water every morning, then cross-crawled around your house getting your morning routine done, and then took the super greens and the essential source, and then some adrenal support to help reduce inflammation, and then some nitric oxide to increase circulation. Some pretty powerful stuff. I'm not even asking you to change anything. Just add to it. Then you start cutting out the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Cut back on the coffee, and you'll be fascinated in most cases what happens. It's really cool to see how the body starts to reboot itself, and then we get you on an anti-inflammatory diet. Let's talk about that now. As far as inflammation goes, the 7 deadly sins are big. Alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Most of you are saying, my God, that's my whole life. Well, yeah, probably. But you need to change that if your goal is to get well. I did a live broadcast of one of my shows, and cousins, it's really kind of cool. All of a sudden, I'm reconnected with my cousins through these live broadcasts on Facebook and Instagram. So make sure you follow me, by the way, on Facebook and Instagram so you find out when we do live broadcasts. And it's really cool. My cousin's cousin, I called him my cousin. We grew up together. He said, Joe, he says, how can we give up wine? He says, why live? And I said, well, Bobby, this is what happens when we get older. You either give up your brain or you give up the wine. It's one of your choices. And I know it's tough, but at least do something. Make some steps here and there so that we can hopefully try to get the body healthier again. And when you give up the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, if you don't know how to do this, go to my website, drjoe.com, and I have 2 lectures that I have on Facebook. One is called, it's on YouTube, I'm sorry. One is called The 7 Deadly Sins of Nutrition, the 7 Foods You Want to Avoid. The second one we have there, and it's free, it's no charge, is So What Can I Eat? Watch and listen to, well, So What Can I Eat is an audio only. Watch and listen to those, and it'll give you a good understanding as to what's going on. But if we're trying to come off the opioids, it's really important that you start taking some positive steps because otherwise you're not going to do it in most cases. Promised you this before the break. The average person may take up to 14,000 prescription pills by the time they're 70 years old. 14,000. Now, aside from the fact that that's not probably, it's going to have some adverse side effects on you, what about the cost? And that's what's cool about this. As we try to get off these opioids or try to avoid getting these opioids, the lifestyle that we're putting together is so much less expensive than anything you're doing right now. So what's going to motivate you? Is it going to be money? Is it going to be saving your liver? Is it going to be time? Is it going to be energy? Is it going to be your love life that you're sacrificing with a lot of these medications? Whatever you do, whatever motivates you to get here, right? The Oleta Adams song from where was it? Gosh, I don't remember when it was. I don't care how you get here, just get here. And that's what I want you to do. I want you to see what's your motivation, but the path to get to your goal is the same. Get the nervous system working, the digestive system working, and good nutrition. So let's talk about some of these medications that you're taking and some of the things we might be able to do to help deal with getting you off them. Once again, I can't take you off them, but you can. CDC health reports. Prescription drugs that are involved in fatal car accident 3 times the rate of marijuana. So if you're taking marijuana, we got you 3 times more risk of getting in an accident if you're taking prescription medications. Prescription medications also killing more people than illegal drugs these days. So we keep hearing these, just say no to drugs and these big movements, but the prescription drugs are becoming a problem as well. Psychotropic drugs are associated with a variety of serious mental and physical problems, including but not limited to benzodiazepines. They're associated with the risk of dementia, certain cancers, premature death, hypnotics, sleeping pills. They've been linked to certain form of cancer and overall reduced lifespan. So let's talk about that for a second. When we start taking medication, many times it's to alter brain chemistry. What if we just fix the brain chemistry? When you were born, when you started out in life, sperm and the egg came together. The first thing that formed, 2 cells became 4 cells, become 8 cells. That was the brain that was forming. So the brain grows a little tail, and you look like a tadpole. And then this little tadpole grows little branches off it, and each branch now controls an organ. So there's a nerve that comes from your spinal cord that controls your heart, your lungs, your liver, your spleen. And the same type of nerves that form your brain form your digestive system. And they're connected together with something called the vagus nerve. Now, the vagus nerve is talking between the brain and the digestive system. So in every case I've ever seen in my career, and I've been doing this for a long time, if there's a mental disorder, there's some type of connection to the digestive system. So if you have acid reflux, heartburn, burping, gas, bloating, many times we have to look at the digestive system to help fix the brain. Probiotics, you hear this all the time. Probiotics, good bacteria. Probiotics are awesome. We have one, Dr. Joe's Probiotics. It's on my website, drjoe.com. Excellent product to take. It helps rebuild the bacteria in your colon, but you also need prebiotics to feed the bacteria. So if you're taking just probiotics and not taking prebiotics, you're growing these wonderful sprouts, if you will, in a garden, but then they're dying off because you need the prebiotics. That's why Dr. Joe's Super Greens and Dr. Joe's Essential Source come into play. They have prebiotics. Then you want to eat more fruits and vegetables, which have what? Prebiotics. So we can rebuild the bacteria in your colon from the damage you've had, and that's going to affect the brain. And so this drives me insane. When people are on medications for mental disorders, I never hear anybody talk about, let's fix the digestive system. So supplements might help. Staying away from the bad foods might help. Fixing pinched nerves. If you have a pinched nerve in your low back, that nerve might give back pain and leg pain and hip pain. That nerve also controls your colon, your sex organs, and your bladder. So now you might see things like gas, bloating, diarrhea, constipation, urinary, sexual problems. So this is where chiropractic ties in with the pain management and helping get people off their medication. If you're in pain, you want to fix the pain, of course, but we want to fix the digestive system, which is controlled by the nervous system, so that we can produce the neurotransmitters to get up to the brain to make the brain work. So that's why I don't like if you just have a back problem, treat the back. Well, maybe we got to treat the digestive system as well. Maybe we got to treat why do you have the back problem? What's your lifestyle like? Maybe you're eating a lot of inflammatory foods. Maybe you're dehydrated. You're drinking a lot of alcohol. Muscles actually dry up. And that can cause muscle spasms. So, folks, if you want to come see us as a patient, in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We would love to be your doctor. So go to our website, drjoe.com. We can set you up an appointment to come see us. If you want to get the supplements, those and many others we talked about, my books, Eating Right for the Health of It, Prescription for Extreme Health, those are also on the website, drjoe.com. So you can go there, order the supplements, also available on Amazon if you have an Amazon account. If you have questions, call us. We're more than happy to answer your questions, but we want to help you naturally get well and stay well. And the website is a great source of information. We have hundreds and hundreds of hours of archived radio shows and videos. So if you're a visual learner, you can watch the videos. If you're an auditory learner, you can listen to radio shows and lectures that I've done. We have articles that I've written there. If you have questions, you can send them to us through the website. Follow me on Facebook. Follow me on Instagram because we send out lots of good information. A lot of times we do live broadcasts on Facebook and Instagram. And send us your email address. I'm not going to give it out to anyone, I promise. But what's going to happen is we have events coming up, always. And sometimes we have free tickets to the event. And we'll give you the free tickets if you're on there. We'll let you know. We send it out. Hey, listen, the first 20 people that want tickets to the event, send it to us. Send us an email. We'll get you the tickets. But without your email address, we can't get in touch with you. So I want to wrap it up here. We've got a few more minutes that we need to talk about. We're talking about getting off opioids or dealing with pain without opioids because the opioid crisis is just out of control and people are dying from it. I've been personally affected by it. I know people that have died from opioid overdoses. You may know somebody like that. You may be the next person. You don't know. You get in a car accident, you start taking some medication to cover up the pain, which you may need, building up one medication, another medication, get on the opioids. Some people have an addictive genetic, and they'll be more likely to get addicted than somebody who doesn't have that. And you don't know you have it until it's too late. So we really want to try to get you well. All right, opioid pain relievers. Let's talk about that. Narcotics. They're associated with increased risk of depression. Now, the number of painkillers has quintupled in recent years. Addiction to painkillers has reached epidemic levels. It's a big problem. Now, let's talk about some other medications, too, while we're here. We got a few more minutes here. ADHD drugs. How many people take those? Raise your hands. A lot of you. This is the thing with ADD and ADHD. ADD is attention deficit disorder. ADHD is attention deficit and hyperactivity disorder. We had a patient come in the other day, and young kid, I don't know, 4 or 5 years old, physically running circles around the room. We have our adjusting tables, our chiropractic tables in the room, running circles around the room, nonstop. I was amazed this kid had this kind of stamina. And he kept going and going and going. And his mother would grab him and sit him down for a second. He'd look around, he'd get up, run. So when I asked the questions about that, I said, what happened? Well, I said, let's talk about digestion. And he asked, reflux, heartburn? Well, I don't know. He's aphasic. He can't speak. I said, how about when he goes to the bathroom? Really stinky stools? Oh, my God, it's horrible, Doc. It's like an animal died. So I explained to her that the stomach breaks proteins into amino acid. The amino acid tryptophan becomes serotonin. Serotonin helps calm you down. Serotonin becomes melatonin, which helps you sleep. Oh, Doc, he's horrible at sleeping. He's up all hours of the night. I can't sleep. It's driving me crazy. So we looked at his diet, and she says, well, this is his favorite food. And she pulls out a box, and it's chocolate ice cream sandwiches. Caffeine and sugar and wheat. And she said, this is the one food that I know he'll eat, so I feed it to him all the time. So I had a little project ahead of me, and we're working on the kid now. But boy, after 2 treatments, we pulled his stomach away from his diaphragm. We adjusted his spine, opened up the nerve supply. The mother's like, Doc, he slept almost 8 hours the other night. It was like a miracle. So these medications, the ADD and ADHD medications, are linked to permanent brain damage, liver problems, heart problems, blood vessel damage, heart attack, stroke, sudden death, depression, suicide, and increased risk of cancer. So if there's an emotional issue in your life or somebody else's life, start thinking about the digestive system. And things like Dr. Joe's Super Greens, Dr. Joe's Essential Source, the probiotics, those are all great. But there may be a physical component that we're not addressing. We may have a pinched nerve going to the organ. The stomach may not be working properly. Antidepressants associated with disproportionate number of violent acts, including assaults, suicide, and homicide. Once again, how do we produce the chemicals in the brain? How do we produce the neurotransmitters? We produce those neurotransmitters by making sure we have the proper amount of amino acids. Amino acids become neurotransmitters. And so if you're not digesting your food, or if you're eating food that's hard to digest, some people are eating things like wheat. Wheat has a protein called gluten. Gluten has 2 components, gliadin and glutenin, which are hard to digest. Dairy products have casein. You need an enzyme called renin to break down the casein into amino acids. We as adult humans don't produce renin. So how can we break the casein down into amino acids? Have a real tough time doing that. So start thinking about what you're doing. Start thinking about your spine. Start thinking about your digestive system. Start thinking about your diet to see what we might be able to do to change. So the takeaway, of course, is don't get behind a wheel if you're taking prescription medications that have warnings on them, or even over-the-counter medications. And so many people do this. They take the medication. I need acetaminophen. I'll take it for pain. Acetaminophen, by the way, side note, helps with pain, reduces pain. Ibuprofen reduces inflammation. Sometimes you need both. But the inflammation, you always want to look at the diet. You want to look at we talk about the pH of the urine to see if you're too acidic. We want to make sure that you're getting the right nutrients, because if you're eating an acid diet, alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, you're sucking calcium out of your bones to neutralize the acid in your blood. Well, we need that calcium because calcium also helps calm you down. And so if you're eating a high acid diet, that's very stimulating to your body, because not only things like caffeine are stimulating, but you're preventing your body from having the capabilities to relax and calm down. Then you start having muscle spasms, which can pull bones out of place, which can pinch nerves, which can cause pain, which can lead to more medications. So start thinking about that. And again, if you're taking these medications, please don't get behind the wheel. I'm begging you. Now, folks, I got so much more to cover, just don't have enough time. If you have any questions, go to my website, drjoe.com. If you want to watch hundreds of hours of archived shows or podcasts, you can go to my website. Also, if you like podcasts, it's called For the Health of It. It's on Stitcher, iTunes, and Google Play. You can subscribe. We send out new podcasts twice a week, so you could listen there as well. If you want to make an appointment to come see us in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge, drjoe.com. We'd love to be your doctors. The supplements we talked about today, Super Greens, Essential Source, Adrenal Support, Nitric Oxide, probiotics, those are all on the website too. Folks, at least, I'm begging you, take Dr. Joe's Super Greens and Dr. Joe's Essential Source, minimum amount of nutrients you should be doing. Almost out of time. Once again, the website is drjoe.com. Thanks so much for listening. Tell your friends about the show. We'll catch you next time. Thanks for listening to For the Health Fit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.